Have you ever wondered about the impact of drug shortages on patients' lives? This question has become more pressing in recent years with a troubling trend that has been on the rise since 2021. The first 3 months of 2024 saw a record-breaking peak of 323 drugs in active shortage. The American Society of Health System Pharmacists, a leading organization in the field, has expressed serious concern over this issue. This is not a problem confined to a single class of drugs. Rather, it affects all categories from generic sterile injectable medications to cancer chemotherapy drugs and emergency medications critically needed in hospital crash carts and procedural areas. The consequences are far-reaching and potentially devastating. Paul Abramowitz, CEO of the American Society of Health System Pharmacists, summed it up aptly. It's long past time to put an end to drug shortages. But how exactly are these shortages affecting the medical field and patients? Let's delve into this. Attention deficit/hyperactivity disorder, or ADHD, is a significant concern. The therapies used to manage this condition, like Adderall XR, are in short supply. This leaves clinicians in a tough spot, struggling to provide the necessary care their patients require, and patients grappling with the symptoms of their disorder. Then, we have the cancer treatments. Carboplatin and cisplatin, two crucial chemotherapy drugs, are in short supply. For patients fighting cancer, this shortage is a dire blow, potentially stalling their treatment plans. The National Comprehensive Cancer Network and the University of Utah Drug Information Service have both underscored the severity of these shortages. These gaps in supply reverberate through the healthcare system, compromising the quality of care and adding stress to an already strained ecosystem. These shortages have a profound impact on the health and well-being of patients and the ability of healthcare professionals to provide effective treatment. So what's causing these shortages and how can we address them? Several factors contribute to drug shortages. Manufacturing and quality problems are a major cause. Issues in the production process can lead to recalls and plant shutdowns, causing a ripple effect on the drug supply. Supply chain gaps also play a significant role. These can occur due to natural disasters, political unrest, or other unforeseen events that disrupt the production or distribution of medications. Drug discontinuations are another cause. Sometimes manufacturers stop producing certain drugs, especially those that are less profitable, leaving patients without needed medications. Data from the U.S. Food and Drug Administration, IQVIA, and the U.S. Health and Human Services Office also highlight these causes. So, how can we tackle these challenges? Policy suggestions include increasing transparency in the drug market, investing in resilient and diverse supply chains, and implementing financial penalties for manufacturers who discontinue essential drugs. Addressing these issues requires concerted efforts and federal-level interventions. In conclusion, drug shortages are a critical issue that needs immediate attention. From the daily struggles of ADHD patients to the life-threatening implications for cancer sufferers, the impact of these shortages is far-reaching and devastating. We've seen how all drug classes are susceptible, with particular concern for generic sterile injectable medications, emergency drugs, and treatments for attention deficit/hyperactivity disorder. The causes are multifaceted, with manufacturing issues, supply chain gaps, and drug discontinuations all playing a role. But there's hope. Potential solutions include policy changes, increased transparency in the drug market, and investment in resilient and diverse supply chains. Federal interventions could also be instrumental in addressing this crisis. We're in a situation where drug shortages have hit a record high, with 323 drugs in active shortage in the first quarter of 2024 alone. As Paul Abramowitz emphasized, it's time to put an end to drug shortages. For the sake of patients and healthcare professionals, let's hope that happens soon.